Warning, you are now entering a biohazard area. Warning, you are now entering a biohazard area. Over the past several months, our doctors have been tracking a new disease outbreak in the U.S. We have compiled our findings. Please keep watching for your safety.
Alright, so our vector for Black's disease is the Cimex lectularius, which is also known as the common bedbug. Bedbugs have three main parts to their life cycle, one being an egg, one being an adult, and then the nymphal stages in between. To move on to the next nymph stage, they have to take an obligatory blood meal, and that helps further development, and their skin also has to molt. The mating of the bedbug starts with traumatic insemination of the female, and the females have actually evolved to develop an organ on their abdomen to help kind of soften the blow of that pretty horrifying experience. Then, as you can see on this diagram, the green is that spermangeli organ that I was talking about, and then the eggs are fertilized in the ovaries, which are the brown acorn-looking diagram. The females then lay their eggs in the nests in wall cracks, mattresses, and bed frames, and the eggs then hatch. Well, the feeding. So bedbugs love humans, but why us? Well, bedbugs are nocturnal, and when we are sleeping, we are naturally in their habitats, and so they are able to easily feed on us when we're not knowing that they're feeding. Fun fact, they only bite exposed skin, so if you just really want to ensure that you're not going to get bit, sleep in a parka or something of that sort. Feeding. The labium is inserted into the skin looking for a bloodline that they can tap into. They also produce an anticoagulant that helps them to feed longer without us noticing. Their bodies go from a flat shape to a pretty cylindrical shape as they take up a lot of blood, and their abdomen actually expands to allow them to do that. So their habitat and housing, they live in mattresses and box springs, also in wall cracks and crevices. This is due to humans being an easy blood meal for them, and so they want to live close to them. There's two types of trapping, active and passive. Active traps use pheromones and CO2 to lure in bedbugs, and these are artificially produced. And then passive traps use human as bait to lure in the bedbugs. Both of them can be homemade or store-bought. These are just a few examples of them, and they are pretty effective in trapping. Medical importance, according to the CDC, the bedbugs don't transmit any disease but can be a vector of different pathogens. That's a big shocker, seeing as it is our vector. The major way they generously share these pathogens with us is by defecating after feeding. So when they leave their feces on you, the bites are quite itchy, and so when you scratch your skin, the feces that are contaminated with the pathogens get into your skin. So that's really nice of them. It is important to recognize how bedbug bites look. They are in a line. They look a lot like other insect bites, except for the line-like pattern that they leave on the skin, and this is just due to their biting pattern.
We first calculated the genome size, and it was big enough to be considered a bacterium. We then ran a gram stain test on it, and as you can see by the purple coloring, it was positive. From the gram stain test, we ran an endospore test, and you can see the red coloring here, which led us to the conclusion that it was within the order of Lactobacillus. We then ran a shape test, and it's a little bit hard to see here, but these are small paired cocci. So that allowed us to then run a catalase test, and as you can see by the lack of bubbles, the catalase test was negative. We were able to then say that it was from the family Enterococcicae. We then ran a carbohydrate fermentation test, and we want to look at the lactose category here. The red coloring indicates that no acid was produced, so that means that lactose wasn't fermented. Then we were able to say that it was in the genus Vagococcus. A temperature test revealed that it wouldn't grow in temperatures any higher than 37 degrees Celsius. And then our final test was an H2S test, and there was no precipitate shown, which means that we were working with an unknown Vagococcus, and we therefore named it Vagococcus triticum.
The disease reservoir is crucial in the survival and transmission of a disease. Rattus norvegicus carries Vagococcus triticum without harboring the disease state. This allows any bedbugs, Cimex lectularis, to feed on an infected brown rat and pick up and transmit the disease, prolonging the survival of this disease. This basically means that brown rats can pick up this disease but are unaffected and don't die from it. This allows bedbugs to feed on them and pick up that disease and furthermore transmit it. The brown rat began somewhere in China, but through the use of modern-day travel, the species is now found in almost every country inhabited by people. More specifically, brown rats have higher population densities in more urban areas as they can have more optimal habitats. These urban areas offer intricate sewer systems, which allows this nocturnal animal to travel safely through the use of avoiding people along with this damp, moist environment. Second, they can use alleyways and housing buildings for readily available food supply. This is why you see them scrummaging through trash, or you can catch them in restaurants, in hotels, or restaurants in the city. Regardless, they like to stay in these areas for the readily available food. Now, for interaction with the vector, you like to see that a lot whenever the rats are interacting with hotels. This allows them to go into a place that is common for the vector, aka bed bugs, allows those bed bugs to feed on them and catch the disease or keep spreading the disease to the reservoir, and thus giving disease-ridden bed bugs a chance to feed on the dead-end host.
The geo-range for our susceptible hosts are currently found in densely populated areas such as New York and Washington. However, the host has made its way to more rural areas such as Bryan, Texas. Major symptoms that emerge from the infected humans include subcutaneous hemorrhage, multi-organ failure, acidosis, abdominal and lower back pain, hypotension, bruising and wounds, fever, and the infected areas include the abdomen, legs, and arms. Hypotension, bruising, and pain in the abdominal area, and multi-organ failure were symptoms that the majority of patients endured with Black's disease. The disease type for Black's disease is a deep soft tissue infection. Deep soft tissue infections can be mild to severe depending on how infected the deep layers of the skin are. The infection is started by a skin infection such as a wound, which many of the patients had, mainly in the legs, arms, and abdominal wall. The patient zero for this disease is 43-year-old Juliana Gordon. She brought the disease to the U.S. from London after she was exposed to different animals and an infestation of fleas, ants, and bedbugs in her home. She then decided to leave London and return to the United States, where she resided at the Muse Hotel in New York for a few days. After staying in New York, she traveled through Washington, D.C. and stayed at the Jefferson Hotel, where many other patients had stayed and contracted the disease. Finally, Gordon settled in her new home in Bryan, Texas, where she lived with Ariana Black, who was also an infected patient.
Firstly, we will discuss the overview of human hosts. The first population at risk is the elderly. The next kind of go hand in hand. This is the immunocompromised host. Now, because of both of these populations, immune system is already at risk and is already exerting so much energy trying to keep the body sustainable, there is not enough energy to combat the deep soft tissue infection. Next, we have the severely ill and those with serious comorbidities. Now, the areas of exposure that we've seen, firstly, starting with New York, we've seen 555 fatal cases. Next, Bryan, Texas, which is really far south, with 147 infected and all but one died. Also, we have Wisconsin, where one person contracted the disease, and in ICU, where they had no previous contact with the infected animal or person. And lastly, we've seen cases in Washington, D.C. with 212 fatal cases.
This is the control plan for Black's disease. This is the disease map for Black's disease. The arrows represent the links in the disease map. Our goal is to break each link to stop the disease.
The brown rat is the reservoir. The rat obtains the pathogen from the bite of an infected bedbug. Non-infected bedbugs can then obtain the pathogen by feeding on an infected rat. Eliminating the infected rats is essential in breaking the link between reservoir and vector and also reservoir and pathogen. Kitchens should be kept clean, there should be consistent waste management, and people should avoid clutter buildup to maintain good hygiene. Food should also be stored in the refrigerator and not left out. When following these good hygiene tips, there is an automatic decrease in the availability of resources that rats can use to create their nest. Rat traps will be placed in all the locations of the different cities plagued with the disease. A survey will be required of any city that a known infected person has traveled to. All other cities are encouraged to set up traps. Baiting is a type of trapping that is known to eliminate a large amount of rats and to eliminate them quickly. These traps will be used in large buildings and urban settings where people are more at risk to live closely by rats. Baiting traps can trap at least 12 rodents at once. In areas where there are more rural settings, like Bryan, Texas, snap traps and live traps are encouraged to be used. Snap traps can be placed more freely in these areas because people are less likely to see them and they work quickly.
In public parks, live catch rodent traps will be placed in various hidden locations. Live traps are reusable and allow the capture of living rats. Captured rats can then be used by the Public Health Disease Control Team to test the pathogen to try and find more effective medicines and preventable measures. By eliminating the rat population, the link between reservoir to vector is broken since there are no more rats for the bedbugs to feed on. There is no direct way to break the link between the pathogen to reservoir, but by eliminating the reservoir completely, the pathogen becomes harder to spread.
The bedbug is the vector of this disease. The bedbug can obtain the pathogen by feeding on an infected rat. An infected bug could then transfer the pathogen to a non-infected rat or to a human by feeding on them. By eliminating the vector, the link between the reservoir and vector, the pathogen and the vector and the human will break. Integrated pest management, or IPM, includes techniques like steaming and fumigation by using aerosols simultaneously. By steaming for over 2 hours with temperatures above 71 degrees Celsius, bedbugs die. Using a dryer also kills bedbugs, and it's a really cost-effective way to get rid of them in your bedding. Steamers can also be rented if citizens cannot afford them. There are recommended pesticides like dichlorvis that should be used because of resistance. These insecticides can be bought commercially for people that would like to get rid of the bedbugs themselves, or there are exterminators aware of the situation who can be enlisted for their service if chosen. Residents are encouraged to keep their houses clean and rid them of clutter where bedbugs can hide. Integrated pest management and cleanliness should reduce the bedbugs in the area with humans, reducing the number of affected persons.
Vaccinations and education are direct ways to break the link between pathogen to humans. To first educate the public, a news story on Black's disease will be released. The news story will encourage people to attend a public forum where they will learn how to reduce the risk of infection and be given general information on how to eliminate pests and where to get vaccinated. Face-to-face outreach education would be implemented in the cities where the disease has shown to be present. Incentives such as food or rat traps will be given during the public forums to increase attendance. The outreach education would inform the public on ways to get rid of and prevent bed bugs using affordable household items and how to trap brown rats. Images of the bed bugs and brown rats will be presented so that people know exactly what to look for. Rat traps and pesticides will be used during the outreach education programs to demonstrate how to properly use them. Extermination teams' contact information will also be given out during the meeting. Flyers with the information about the disease and how to stop it will also be passed out at schools and various community centers.
Vaccinations will not be mandatory, but they will be available for the disease in every city. It is highly encouraged for the cities where there are infected people. People can get vaccines from any clinic and hospital. In rural areas, there will be pop-up mobile clinics so people don't have to travel far to get the vaccines. Volunteer nurses and nursing students in their clinical semesters will work in the mobile clinics. These vaccines will be given out for free, so cost will not be an issue. Successful vaccinations will immediately reduce the number of infected people. Educating the public will also decrease the number of infected people, breaking the link between pathogen and human hosts. If there is another outbreak of the disease in the future, the case will be monitored and quarantined. And if there is another outbreak after that, then the control plan will be implemented again in that city until the disease has been fully contained.
Antibiotics will be administered to patients who have already contracted Black's disease to kill Vigococcus traditium in the human body. When the patients come into the healthcare setting, a bacterial sensitivity test will allow us to test for the presence of the bacterium in the body so that we can avoid administering broad-spectrum antibiotics, and instead we can treat with narrow-spectrum antibiotics that we have developed. The antibiotics will break the replicative link in the human host. It's come to our attention that some members of the public are worried about the safety of our vaccine. We want to assure that the worried members by releasing research studies testing the safety and efficacy of our vaccines, along with testimonies from healthcare professionals. The vaccine is 94% effective in preventing new cases of the disease, and no reports of side effects from doctors or other healthcare professionals have been reported. We recognize the concerns and fears of PROVE and the Vaccination Liberation Group and ask them to contact us for more information on our studies and research, which can also be found on our website. Although there is currently no long-term follow-up data, we have followed prior protocols on developing vaccines for extended use and maintain that the appropriate dosage will not cause chronic toxicity. While we have developed antibiotics that can save the lives of the affected, the disease progresses rapidly, and administration of the antibiotics can be delayed by misdiagnosis. We recognize the right for people to choose not to be vaccinated, but to stop the spread of the highly fatal disease, we ask those concerned to reconsider and ask everyone to get vaccinated at your local doctor's office or at one of the mobile vaccination clinics. We have made the vaccine free of charge using grant money in an effort to stop the spread of Black's disease.